Good morning, everybody. I'm Greg Fisher, the mayor of Louisville. We're on with our briefing for COVID-19. Before I do that, I just want to take a few moments to reiterate, as we've been saying for the last few days, that we're obviously aware that today is a day of planned protest in the city. We are monitoring multiple groups of demonstrators. We're in communication with several of them. One of the organized groups, Until Freedom, has announced that today is a day of action and plans for a nonviolent march. Until Freedom has a history of no violence. One thing that we have observed since the protests began almost 90 days ago is that many times the web, social media really whips things up and spreads information quickly. So a lot of times that information is not, or those rumors have not materialized. And when it has, LMPD has been prepared to handle the events that have taken place. So this is a fluid situation. And as always, we're monitoring and will respond as appropriate. LMPD has plans in place to step in when needed to ensure order and just encourage all protesters to please do so peacefully, respect the First Amendment, but be peaceful in the protesting. We will not allow unlawful protest. If people are blocking traffic or creating dangerous conditions on our roadways or trespassing on private property against the wishes of the property owner, the police will cite and/or arrest them. Anyone committing violence or vandalism will be arrested. So let's remember, racial justice is a goal that we all support, and we support First Amendment rights. We just have to balance the right to protest with our essential duty to preserve public safety. We're going to continue to monitor the situation with protests throughout the day. Also, on a different note, today is the first day of classes for Jefferson County Public Schools. I want to thank Dr. Marty Polio and his team, as well as the JCPS board, for their hard work, with a special thanks to and appreciation for all the teachers, the parents, and the students who are having to adapt to these COVID circumstances so young people can continue to learn with non-traditional instruction as we fight this virus. So let's continue to remember to make good public health practices all part of our daily routine. So wearing masks, social distancing, avoiding crowds, crowded gatherings. And the sooner we do that, the sooner we can get our kids back to school. So good luck, JCPS, for this school year. All right, here's our daily data. As of today, we've had 11,503 COVID-19 cases in Louisville and 277 deaths. That's 225 new cases and no deaths to report since yesterday. Also, to date, we've conducted 125,279 tests. Of the 11,503 who've tested positive, 6,386 have recovered. We've got 129 people in the hospital with COVID and 45 in the ICU. Our positivity rate now is 9.18. So it continues to inch up. Please, let's remember the practices so we get it to go down. And at Metro Corrections, 2,944 inmates have been tested since the outbreak began, and we've seen 180 positive tests. So looking at the bigger picture, the key issue, and the one that we continue to report on, is that not everybody is suffering at the same level in the community. And you can see that when we look at our cases and deaths through the lens of race and ethnicity, remember that our city's Black community makes up 24% of our overall population. So you see here on the confirmed cases, it's 58% white, 29% Black on confirmed, and 28% on deceased as well. So we have a disproportionality there that's been in place in our society for quite some time that we're going to continue to work on. In terms of confirmed cases, 11% Hispanic Latino, and 3% of the deceased are within that population as well. So we know what works. We want to focus on the basics here today, and on the individual level. Again, everybody can say it and knows what it is, right? Wearing masks, social distancing, washing hands, and avoiding large crowds. And at the city level, one of the keys to this effort is making sure that everybody has access to testing. And that's particularly important in our communities of color, which, as we just saw, have been hit disproportionately hard. So Bill Altman is with us. He coordinates our testing operation. And Bill, I understand that you have some positive announcements related to testing that we're going to share today.
Yeah, thank you, Mayor. And as you said, our testing strategy has always been premised on the principle that and the strategy that we need to bring testing resources to those who need it most. And as you've said, communities of color, immigrant communities, and others are, by the data, at higher risk of contracting the virus and then a disproportionate impact on their health outcomes. So we're bringing more testing resources to that community in addition to what we've already done. And there are 3 real announcements, at least for now. There'll be more in the future that reflect that testing strategy. So, for example, we're opening a new site at the YMCA in the south end of Louisville off 6 Mile Lane Road. This is in partnership with the YMCA, Blue Water Lab, and led by the Office of Globalization. Sabine Nassim, who is a good member of your team, has been very actively engaged with the community to bring this new site at the YMCA off Bardstown Road on the south end. We know that is an area through the data where we need to bring more testing resources. Should also mention, Mayor, that this partnership with the community in bringing these testing sites is really important because they have given us valuable input, not just where we should place the testing, but what hours make sense. So as an example, this new testing site is going to be open from Fridays, 1 to 7. Because there's a local mosque nearby. And so in conjunction with the prayer services, we know people are going to be there, and that's a convenient time to get testing resources. That site will also be open on Saturdays because we know people need that access to testing. So that's one new announcement. And that one, I should also say, does not require advance reservation. Blue Water has found that in some of their sites, they can actually get more people tested if there aren't advanced reservations. And so they've adopted that model in some of their sites. And so that's a particular site at the YMCA Southeast where you do not need a reservation. The second one that is being opened up, again, it's with our great partner, Steve Tarver and team at the YMCA and Norton Healthcare on the YMCA site on West Broadway, the Traeger Republic Health YMCA in that setting. And that one, again, is being administered by Norton. And it's going to start 3 days a week next Tuesday and include some Saturday hours. That one does require advance registration, which has worked extremely well for Norton because they can register people in advance and get a lot of people through. I should say with both of these sites, one is 4 days a week, one is 3 days a week. We'll see. If there's a demand for more testing resources, we'll expand it. We'll expand the hours. We'll bring those resources to the community. And the last one to announce is Family Health Centers. They have 4 sites throughout Metro Louisville. That's in partnership, again, with Blue Water Lab, a great local lab company. And they've expanded the hours at all of those sites, expanded the hours at their Portland site, Americana, Fairdale, and one other site. So those are all, recent announcement on expanding testing resources, making sure that we're bringing testing resources to the communities that need them most. I should mention that there is plenty of capacity. I can say that at the Blue Water site at Southeast Christian Church on the East End, there is capacity to take more people and get more people tested. Again, no reservation needed there. There's capacity at the Norton site on Audubon. There's capacity at the recently announced University of Louisville sites with Gravity Lab, another local lab sponsored by the state, downtown, St. Mary's. So, we encourage people who, first and foremost, are symptomatic. If you're a healthcare worker, if you've been exposed to someone, those are the highest priority people who should be tested. There are plenty of testing resources available to those priority groups, and other people who want to get tested can also make that reservation in advance. The last thing I would say, Mayor, is that we have experienced, improvements in the turnaround time for getting test results. As I've said before, the local labs, Blue Water, Gravity, others, that testing time has always been 24 to 48 hours. The problem with the national labs, Quest and LabCorp and others that have been sent out for testing because of national capacity concerns, those delays have gotten a lot better. So we're getting testing results back more quickly. So that's the status update for now. But I would just say keep your your ears to the ground, and more importantly, keep your eyes on the website at the Department of Public Health and Wellness, where we update regularly the latest on the availability of testing, the hours, the requirements that are needed for the different testing sites. And there'll be more announcements in the future about the testing that we're bringing to the community.
All right. Thank you, Bill. I think that puts our total number of testing sites out in the public on 22 or so. Does that sound right?
I think that's right. Something in that neighborhood.
All right. Well, thank you for that. All right. Well, that's our announcement for today. So with that, we're happy to take any questions from the media. All right. We're waiting. Okay. Debbie, has contact tracing improved with improved test times? That's from Debbie Yetter. Karen Handmaker, would you like to handle that?
I think that definitely makes a difference. Thank you, Mayor, and thank you, Debbie. Having the test results come in soon allows us to do contact tracing sooner, and we are prioritizing people to call based on when their test was taken. So we are doing everything we can to try to tighten that and shorten that gap between testing and tracing.
Good, thank you. Okay, Amina Elahi, as a follow-up to your statement from earlier on the Courier Journal article, was there anything in that article that you believe to be false or inaccurate? And then another question on that from Candace Cliff. Could you please explain your concern with the information released and explain why it was taken down? You know, we're still trying to get clarity on the information in the articles. What is clear is that Breonna Taylor should not be dead, period. That is a tragedy that our city wish never happened. So any information that comes out to try to impugn her character is not relevant to relative to the investigation. We have been insistent that, and per the instructions of the Attorney General and the FBI as well, that this investigation has integrity to it. No information comes out that would potentially impair any criminal charges that could come from that as well. So we're trying to get clarity on what all is in the article so that we can respond more fully later. But again, Breonna Taylor should not be dead, period. We put out a statement early this is from Amina. We put out a statement after we saw an initial view of the article early this morning that just expressed, again, what the community is looking for is justice and truth. In this case, the community needs to be healing right now. And today's story included information that was related to Breonna's case, but didn't have anything to actually do with the investigation itself. So it's important that the integrity of the information process is followed, and articles like this create information or create stuff that's not relevant to the actual investigation. So I think it's reckless for information like this to come out. It's not helpful to the city or the investigation at all. And I think it's unjust to draw conclusions from just pieces of information and not the whole case. So that's what we're going to continue to encourage people to do, is follow the integrity of the process and stay to that. Are we worried about the spread of the virus at today's demonstrations? Well, you know, we have not been able to trace any of the virus to demonstrations so far. I think we had one particular case to it. That demonstrations are outside. The virus does not spread easily outside. So we ask people to wear masks when they're demonstrating, just as we would going about their everyday life. So you have to be concerned about what the virus is doing in the community. It continues to inch up every day. So we just continue to suggest people follow the basic public health practices that we've gone through. All right. A question from Candace Cliff. Are contact tracers asking specifically about protest activity? Karen?
Thank you. Another good question. we do ask everybody about where they were when they might have become infected, or where they may have been after they were infected, so that we can trace that. And that would certainly include protest activity.
All right. All right, folks. Well, that looks like all of our questions for today. So congratulations to the public health team on these 3 new testing sites that are targeted to further reach our African American and Hispanic communities in the city as we work on the disproportionate effect of this virus. So everybody, please maintain all of the good public health practices as we work together to defeat and push back COVID-19. Thank you.